161. The nurse should teach TB patients to report dark urine.
True or false?
Answer. True. Rationale. Dark urine may indicate hepatotoxicity from TB drugs like rifampin or isoniazid, requiring immediate reporting per patient education guidelines. 162. TB can be diagnosed using a blood culture. True or false? Answer. False. Rationale. TB is rarely diagnosed via blood culture, as Mycobacterium tuberculosis is primarily detected in sputum or tissue per CDC Diagnostics. 163. Contact tracing is unnecessary for latent TB cases. True or false? Answer. True. Rationale. Latent TB is not contagious, so contact tracing is not needed, unlike active TB, per WHO Public Health Strategies. 164. The BCG vaccine increases the risk of active TB.
True or false?
Answer. False. Rationale. The BCG vaccine does not increase TB risk. It aims to reduce severe forms, though efficacy varies, per WHO vaccination data. 165. TB can cause erythema nodosum as a hypersensitivity reaction. True or false? Answer. True. Rationale. Erythema nodosum, painful skin nodules, can occur as a hypersensitivity reaction to TB infection per clinical manifestations. 166. A positive sputum smear always indicates MDR-TB. True or false? Answer. False. Rationale. A positive sputum smear indicates TB, but does not specify drug resistance, requiring susceptibility testing per WHO Diagnostics. 167. The nurse should assess for fever in suspected TB cases. True or false? Answer. True. Rationale. Fever, often low-grade, is a common symptom of active TB, requiring assessment per clinical evaluation guidelines. 168. TB treatment can be safely stopped if sputum cultures are negative after 1 month. True or false? Answer. False. Rationale. TB treatment must continue for 6 to 9 months, even with early negative cultures, to prevent relapse, per WHO guidelines. 169. HIV testing is recommended for all TB patients. True or false? Answer. True. Rationale. HIV testing is recommended for TB patients due to the high risk of co-infection and its impact on treatment, per WHO co-infection guidelines. 170. The nurse should use gloves when handling TB patient specimens. True or false? Answer. True. Rationale. Gloves are part of standard precautions when handling potentially infectious TB specimens, per CDC infection control standards. 171. TB can cause meningitis in children. True or false? Answer. True. Rationale. TB meningitis is a severe extrapulmonary form, more common in children with high morbidity, per clinical manifestations. 172. The quantiferin TB Gold test is performed on sputum samples. True or false? Answer. False. Rationale. The quantiferin TB Gold test is a blood-based IGRA, not performed on sputum, per CDC Diagnostic methods. 173. Patients with active TB should avoid strenuous exercise. True or false? Answer. True. Rationale. Strenuous exercise may exacerbate symptoms like dyspnea in active TB, requiring rest during early treatment, per patient education guidelines. 174. All TB cases are caused by Mycobacterium tuberculosis. True or false? Answer. False. Rationale. While most TB is caused by Mycobacterium tuberculosis, other species, e.g., Mycobacterium bovis, can cause TB-like disease, per CDC etiology. 175. The nurse should teach TB patients to report numbness in extremities. True or false? Answer. True. Rationale. Numbness may indicate peripheral neuropathy from isoniazid, requiring immediate reporting, per patient education guidelines. 176. TB can be transmitted through kissing. True or false? Answer. False. Rationale. TB is not typically transmitted through kissing, as it requires inhalation of airborne droplets, per CDC transmission routes. 177. A chest X-ray showing a tree and bud pattern is suggestive of TB. True or false? Answer. True rationale. The tree and bud pattern on chest X-ray indicates endobronchial TB spread, suggestive of active disease, per radiologic findings. 178. Latent TB treatment is ineffective in preventing active disease. True or false? Answer. False rationale. Latent TB treatment, e.g., isoniazid, significantly reduces the risk of progression to active disease, per CDC preventive therapy data. 179. TB can cause osteomyelitis in extrapulmonary disease. True or false? Answer. True rationale. TB osteomyelitis, affecting bones like the spine, Pott's disease, is a form of extrapulmonary TB, per clinical manifestations. 180. The BCG vaccine is a live attenuated vaccine. True or false? Answer. True rationale. The BCG vaccine contains live attenuated Mycobacterium bovis, used to stimulate immunity, per WHO vaccination data. 181. The nurse should monitor for rash in patients taking rifampin. True or false? Answer. True rationale. Rifampin can cause allergic rashes, requiring monitoring and reporting if severe, per pharmacological side effects. 182. TB is only contagious in immunocompromised patients. True or false? Answer. False rationale. TB is contagious in any patient with active pulmonary disease, regardless of immune status, per CDC transmission principles. 183. A 15 mm induration on a TST is positive in low-risk individuals. True or false? Answer. True rationale. A 15 mm induration is considered positive in low-risk individuals with no known TB exposure, per CDC TST interpretation criteria. 184. TB treatment can cause permanent vision loss. True or false? Answer. True rationale. Ethambutol can cause optic neuritis, potentially leading to permanent vision loss if not addressed, per pharmacological side effects. 185. Patients with active TB should have regular chest X-rays during treatment. True or false? Answer. True rationale. Periodic chest X-rays monitor treatment response and disease progression in active TB, per WHO monitoring guidelines. 186. The T-spot TB test is more accurate than sputum culture for TB diagnosis. True or false? Answer. False rationale. Sputum culture is the gold standard for TB diagnosis, while T-spot TB detects infection, not active disease, per CDC Diagnostics. 187. TB can cause a positive ANA test in autoimmune-like reactions. True or false? Answer. True rationale. TB can trigger autoimmune-like responses, occasionally causing a positive ANA test, per clinical manifestations. 188. All TB patients require hospitalization during the intensive phase. True or false? Answer. False rationale. Most TB patients can be treated outpatient during the intensive phase, unless severe or non-adherent, per WHO treatment protocols. 189. The nurse should teach TB patients to avoid grapefruit juice during treatment. True or false? Answer. True rationale. Grapefruit juice can interact with TB drugs like rifampin, affecting metabolism, per pharmacological interactions. 190. TB can cause a normal sputum culture in early disease. True or false? Answer. True rationale. Early active TB may yield negative sputum cultures due to low bacterial load, requiring molecular tests, per CDC Diagnostics. 191. Patients with MDR-TB should be isolated for the entire treatment duration. True or false? Answer. False rationale. MDR-TB patients require isolation until non-infectious, e.g., negative sputum, not for the entire 18-24-month treatment, per CDC infection control. 192. The BCG vaccine is safe for HIV-positive individuals. True or false? Answer. False rationale. The BCG vaccine, a live vaccine, is contraindicated in HIV-positive individuals due to risk of disseminated disease, per WHO guidelines. 193. TB can cause a productive cough as a primary symptom. True or false? Answer. True rationale. A productive cough is a common symptom of pulmonary TB, especially in advanced disease, per clinical manifestations. 194. A negative chest X-ray rules out extrapulmonary TB. True or false? Answer: false rationale. Extrapulmonary TB may not appear on chest X-ray, requiring other imaging or biopsies for diagnosis, per CDC Diagnostics. 195. The nurse should assess for lymphadenopathy in suspected TB cases. True or false? Answer: true rationale. Lymphadenopathy, especially cervical, is a common sign of extrapulmonary TB, requiring assessment per clinical evaluation guidelines. 196. TB treatment is safe during pregnancy. True or false? Answer: true rationale. Standard TB drugs, e.g., isoniazid, rifampin, are generally safe in pregnancy, with benefits outweighing risks, per WHO treatment guidelines. 197. The GeneXpert MTB/REF test is used for latent TB diagnosis.
True or false?
Answer: false rationale. The GeneXpert MTB/REF test is used for active TB and resistance detection, not latent TB, which requires TST or IGRA, per WHO Diagnostics. 198. TB can cause anorexia as a systemic symptom. True or false? Answer: true rationale. Anorexia, loss of appetite, is a common systemic symptom of active TB due to chronic inflammation, per clinical manifestations. 199. The nurse should teach TB patients to report hearing loss while on streptomycin. True or false? Answer: true rationale. Streptomycin can cause ototoxicity, leading to hearing loss, requiring immediate reporting, per patient education guidelines. 200. TB is a vaccine-preventable disease in all cases. True or false? Answer: false rationale. TB is not fully vaccine-preventable, as the BCG vaccine has variable efficacy and does not prevent all cases, per WHO prevention strategies.